over to Gordon. I teach in the Cornell Institute for Public Affairs in my life outside of town board life. So I have a dual interest in this project as Deputy Supervisor Town of Dryden and also as a professor at CEPA. And we looked at this at the subcommittee level of TCCOG on the EMS committee last summer as something that CEPA might get involved in and take a fresh look at what is happening in Tompkins County with regards to resources matching needs and EMS, but also with an interest in what more could be done at the state level. And we were able to use some contacts that both Rorden and I had with the state Senate to put the students in touch with some Senate staff to get additional insights. And I think it's been a pretty good opportunity to address this issue and to freshen up the statistics from a couple of years ago and look at this growing need. So CEPA is really proud to be part of this and to play a role in helping the community, helping TCCOG. I think the students have really stepped up to this project. And I appreciate Rorden Hart, who also serves on the EMS subcommittee, serving as client. So I'm not directly involved since I'm the professor in this class. I shouldn't necessarily be the client. And so Rorden has done a fantastic job of using his background and knowledge about this issue to guide the students. So I'm going to pass it off to Mayor Hart.
Thanks, Dan. Appreciate it. I'm hoping Michael is on. I see he's on and muted. I am the mayor in the village of Trumansburg, and Ben Carver, who is part of this report team, is deputy mayor here in the village, and he and I have worked together over the years, coordinating a whole host of things with respect to our EMS department. Trumansburg Ambulance, or Trumansburg EMS, started out many years ago as a function of our fire department, and over time grew to accommodate paid staff. We, about 11 or 12 years ago, went to 24/7 ALS, or advanced life support coverage. And since then, the scope of the department's work has only grown. So I was very interested, when given the opportunity to have this class investigated further, I was very interested in seeing what they could generate in terms of data and statistics, as well as doing some type of comparison of our department relative to the region. Trumansburg is a small community, of course, but our coverage area for ambulance stretches to almost 400 square miles now, when you include mutual aid coverage. So it's a growing service, it's a needed service, and I view it from inside my bubble, so I was curious to see what it looked like on a broader scale. So Dan invited me to speak to the class on kind of a 10-minute crash course in all things rural EMS in New York. And I was thrilled that there was a group that wanted to investigate it further, and looking forward to seeing the fruits of their labor this morning. So with that, I think I'll just turn it over to Ben and Rebecca and the rest of their group, and let you begin your presentation. I do see, and I'm just checking the participants list, I don't think we will necessarily go around and introduce everyone, but I certainly do notice Irene Weiser, who worked on the last EMS report back in 2016-2017 timeframe. I see Ann Corman, who's the county legislator from our district here in this corner of the county. I see Amy Hendricks. Thanks for joining, Amy. Deputy County Administrator. And if I've left anyone else out, I apologize. Of course, Michael Stitley is the new Director of Emergency Management for Tompkins County. So thank you, everyone, for coming.
And Mark, if you could just let me share my screen, we'll get started.
Yeah, you should be good to go, Ben. I just made you co-host.
Great, thank you. So, hi everyone. I won't go through the list of names again, but thank you all for being here. Thanks for your interest in EMS. As Dan and Rorden have mentioned, we're here to discuss a report that was commissioned by this subcommittee and is provided through a partnership with TCCOG and the Brooks School of Public Policy at Cornell. Our team is composed of SEPA students enrolled in Public Administration 590 with Dan Lamb. And that's Yichun Song, Jada Wang, and Rebecca McDonald, who you'll hear from shortly. And we've been working closely with Rorden, as we've just discussed, over the last several months to prepare this report. So the objective of the report is both to update previous Tompkins County EMS studies and to provide a bit of a wider view on the trends sort of in the industry and the ways that Tompkins County and rural upstate more generally can respond to those trends. So we'd like to just quickly start by acknowledging the many people who have helped our team with this report. Obviously, Rorden and Dan, who have put a large number of hours, let's just say, into helping us prepare this. Also, Brian Wilbur and Wendy Kozlowski, who were instrumental in helping us find and process the data that we need for our analysis. So we'll begin sort of with a brief overview and history of EMS, a fairly broad industry assessment that begins at the national level and then kind of zooms into the county level. We'll then move into a discussion of our data methodology and analysis and some more qualitative analysis. And we'll end with our recommendations and conclusions. I would also like to just quickly add that if you could hold questions for the end, that would be much appreciated. And if you'd like to see a list of our sources, copy of the full report, if you have any questions or comments that we aren't able to fit in today, please feel free to reach out. We would be more than happy to field those requests. So with that, I'll turn it over. Oh, I'm just realizing that maybe Yichun isn't here.
Looks like we are missing one team member. Ben, would you mind covering the history, and then we'll cover the rest of the parts and see if she can join?
Yeah, sorry about that. I didn't catch that at first. So the history of EMS is really, I think, fairly important to understand where we are now, to just get a little sense of the history. So EMS started sort of as a novel idea during the French Revolution, Civil War era, and was really about generals sort of discovering that, like, hey, we can pull our soldiers off the battlefield, save their lives, and they can fight another day. So it was really a question of like resource efficiency. That kind of evolved. The early 1900s, you see the sort of beginning of fire department or mortuary run EMS departments that were essentially a hearse or a big horse and buggy that were basically taking people. It was really just transportation, so no medical care rendered. And then eventually you see the sort of inclusion of increasing levels of medical care in the mid-60s. Lyndon Johnson made improving EMS throughout the country a pretty strong piece of his platform, I would say. And that led to the Highway Safety Act of 1966, which saw the investment of, inflation adjusted, maybe about $1 billion over the next 2 decades or so in creating grant programs to advance EMS, and particularly the medical sophistication of the techniques that EMS used. In about the 80s, that federal support really fell off, and you see sort of a development of a much stronger state regulatory regime. Now those are different from state to state, obviously, but they do, I think in New York State, we're all reasonably aware, I hope, that we have a fairly strong regulatory regime. Now there are, obviously, if you sort of zoom in further to the more local level, it's a bit fragmented. But then you can see it's sort of our next steps, which we'll get to later on in the presentation.
Okay, in different states, they have different state funding models. In Ohio, they have the EMS grant program, and in New Mexico, they have system improvement plan. And in Pennsylvania, they have the EMS operating fund. And you can find their funds all comes through the traffic ticket revenue or the state budget allocation. And all these 3 states funding models, they all have the state government or state agents to oversight. And this fund be used to training the volunteers, buying the equipment of EMS, such as a vehicle, and to improve the service quality. Next slide, please.
Okay, so after comparing how different states fund their EMS programs, we then look at the different types of provision models, which, as you can see, just from these few main ones we've pulled out, are pretty diverse. We pulled out some key factors from the models and applied them to rural districts. Those include employee types, as well as some main funding sources for each type, which can definitely vary beyond the ones that we've listed here. For example, municipalities have flexibility on whether they decide to bill for services rendered on scene or just transports to medical facilities. Nonprofits and volunteer-based organizations have fundraising options available to them, which include donations and grants. And then finally, we applied rural population considerations to the viability of these models. In Tompkins County, we've already seen that Bangs, the only for-profit company in the area, is pretty reluctant to serve rural areas outside of Ithaca due to the low revenue potential. Nonprofit models need fundraising abilities, so although they could be in rural districts, they could have difficulty raising community donations and would have to rely on grants and other means. Municipalities, by subsidizing EMS operations through taxes or other funds, have the ability to serve rural areas, but at the cost of budget strains. We did this comparison to kind of look at the viability of the different models in rural areas, the current ones, and they each come up short in different but pretty crucial ways. And I'm going to pass it off to discuss other task force reports.
For the task force report, to understand the EMS task force recommendation in depth, we researched on the previous SEPA report as well as the EMS report in other counties. The 2017 SEPA report made several recommendations. Firstly is a county-wide document of shared understanding should be created. And secondly is the district, the fair department and agencies should provide the personal asset status report to county dispatch prior to a day's activity so that available assets can be known. And lastly, the county should implement a quality assurance program, the QAP, to analyze the current methodologies and the metric, including the volunteer level and the response times. From the 2018 SEPA report, they recommend that the EMS task force should establish a data collection process which collects the department operation data biannually and distributes the questionnaires to department annually. Secondly, they recommend the DOER create a paid, full-time recruitment and training the coordination positions. And lastly, but most importantly, they recommend the coordinating mutual aid in rescue squad using a polling system without scheduling. And from the ESEX County EMS report, they also made several useful recommendations. Firstly, from the organization and operation development perspective, this should be a centralized authority for fire and rescue service. A strategic planning, accountability practices, and fire prevention activity. Secondly, from a communication perspective, they recommend improving the dispatch system and increase the level of interdepartmental communications. And lastly, from the budget and administration perspectives, a formal financial accountability system should be developed, and improvement in county funding and capital improvement and standardization for the purchasing should be made. Okay, next slide.
So our data analysis efforts were obviously primarily guided by a desire to update the analysis conducted for the earlier SEPA reports, and also just to present an objective measure of EMS system performance in the county. So to that end, we contacted Justin Van, who I notice is on this call, at the Department of Emergency Response, who helped us get call report files for every call in the county from 2017 to the present. Now, obviously, we realized rather quickly that we bit off a little bit more than we could chew. So we decided to focus just on the most recent year. We also have used national data published by the National Highway Traffic and Safety Administration through the NEMSIS Data Cube, and obtained municipal budgets from Ulysses and Dryden, both of whom contract for EMS service, to provide a benchmark for EMS costs in general. Now, one thing that we'd like to highlight, this is actually a chart from the earlier SEPA report that shows response times by determinant in a fairly general way. And you can see we've pulled out some of the key statistics on the right there. The one I really want to bring your attention to is the Slaterville average, excuse me, and the total average. And you can see that the way that the team designed this chart, the red is sort of concentrated at the top and the green is down below. So it's sorted based on the length of response times. Now, when we move to the current report, you can see that that red color has really shifted to fill in the whole report. That Slaterville average is now about 9 minutes, and the total average has increased by a fair margin. And what we take from this is really a general reallocation of resources across the county. So you can see that Bangs, by holding the countywide CON, was obligated to move into the Slaterville area and to cover that area, and that pulled resources, because it's a dynamic network, so that pulled resources away from functionally every other district in the county. So that is, I think fairly important to point out. Next, we wanted to really highlight the role that population density plays in response and the way that this comes together. So as you can see, we pulled out populations, number of calls, calls per 1,000 people, and then also calls per square mile. And if you look at the calls per 1,000, you can see it's a fairly tight distribution. I forget exactly what the standard deviation is here, but it's about 50. It's you know, I mean, the range is really 119 to 350 or so. So that's not a huge distribution. On the other hand, calls per square mile goes from 7 to 270. So you can see that population density in that square area that you're covering is really the tripping point for local EMS agencies that really provides the challenge. Population density, this also is associated with billing revenues. Obviously, if you don't have a lot of calls per mile, that means you're doing more work per dollar of billing revenue. And you can also see that the average number of calls here is 27. I believe in the last report, it was about 21 or 21 and a half. So the number of calls has really increased as well since the last report.
The calls by nature, you can say all this data is after cleaned. The data of multiple calls made with the same long-term ID has been excluded. And in this table, we list the percentage of the total calls of each of the categories. And here is a comparison is made between the Ithaca and non-Ithaca, the rural area, to show the difference in demand. And we found several key findings. In Ithaca and the rural areas, the calling of full and sick person is extremely common, and compared with Ithaca, the chest pain and breathing problem in rural area is a common reason, and overdose is only a major problem in Ithaca, which is not common in rural areas.
Sorry, I forgot to unmute. So this data was taken from publicly available municipal budgets for Dryden and Ulysses, because both of those towns provide tax-based support for EMS through contracts for those services. One of those agencies is a municipal agency, which is Trumansburg. The other is a nonprofit in Dryden. And as you can see, we had somewhat better access to budget data for Trumansburg EMS agency. So if you look at that lower right graph, you can see the breakout of personnel costs versus other costs. And generally, you can see, I think, that personnel costs are driving a rise in overall costs, but also that these overall costs are increasing slightly faster than the national healthcare spending. So if you look at that upper right graph, you can see those two overlapping lines that are nearly parallel represent national healthcare spending, and local EMS coverage. And one thing I want to note here is that in 2020, Dryden almost doubled their contract. So I eliminated that as sort of an outlier in the data. So that's why they line up. If I had given the true reflection of that data, there would be a surprising jump in that blue line. That said, the other thing I really want to highlight here is that lower right chart, which shows the percent increase year to year. And I think this is something that all of you are probably likely familiar with. This is, it really shows the sort of peak and valley of these increases. And it, I think, represents the difficulty that municipal leaders have in funding EMS, and that the increases are not always predictable. They're very difficult to handle from the perspective of setting your tax levies.
So after conducting the data analysis, we've highlighted some key figures here. Calls have increased from approximately 22 calls a day in 2016 to 27, even though the overall population of Tompkins County has declined a pretty minuscule amount. A portion of this, let's see, even though, oops, sorry. The increase in calls, we were wondering too if that could be potentially related to COVID and people's reluctance to go into emergency rooms. There wasn't really a way for us to confirm that without doing widespread surveys, but it is a factor that we had to acknowledge. As Ben noted, the resource reallocation to cover Slaterville district has really reallocated resources and had multiple districts see increased call times, even though it did reduce Slaterville's by a significant amount. Finally, within Trumansburg, the staggering increase in tax support for providing EMS services definitely shows an unsustainable rise in costs and the need to find solutions to the issue. I'll pass it off to Jada.
Yeah. For the SWOT analysis, for the strengths, we have compared with many rural communities in New York State, the Tompkins County advantage include a strong tax base, and some agencies have transferred from the entirely of volunteers to full-time paid personnel. And both the policymaker and taxpayer think it is important for the EMS as service in Tompkins counties. And in weakness, first is important is the safety net of the safety net, which means when there is no other choice, the EMS agencies are required to support such as law enforcement, the fire, and other emergency services. And the call increase and the increase multi aid. For the opportunities, we have the state and federal support and optimize the county-wide operations. And for the threats, it is increasing in the cost and the lack of the trained volunteers and EMS staff. Okay, then next slide, please. Then we will introduce our recommendations from the Reframe EMS policy in county and state levels and operations.
Oh, you can see in this chart basically a simple depiction of call locations for Trumansburg EMS. The locations themselves obviously have been slightly adjusted for privacy reasons, but it does illustrate a number of points fairly well. So this represents about 1,000 individual calls responded to by an agency with a single ambulance. You can see the boundaries of the Trumansburg district are that black polygon, and you can imagine that the outline of Tompkins County, I'll just outline it with the mouse here, is essentially this is Ulysses. So the Tompkins County line goes about here and then up and down. So you can see that Trumansburg's de facto coverage area, which expands far to the north, is about 300% of the district size. And it's about 1,000% greater than the part of the district that is in Tompkins County. So you can see that first, EMS providers bring medicine to those who need it. They're the capillaries of the public health system. They provide life-saving care when and where they're called. So EMS is regional. It doesn't adhere to municipal boundaries or jurisdictional divisions. And this is sort of a cautionary note that any attempt to optimize Tompkins County EMS that doesn't account for these dispersed network effects is bound to have substantial negative externalities that radiate far beyond the county line. And it's also just simply an immense amount of work that we're asking our EMS providers to do. This represents 2 providers, 1 ambulance in 1 year. And what you don't see here is the distance covered hospitals that are outside of the district. And I think it's important to highlight that when our EMTs and paramedics are on these jobs, they certainly do it, but they also know that these delays from long distances traveled may be keeping them from saving lives back in their home district. And that leads to a kind of burnout and moral damage that impacts the reason that they became EMTs and paramedics in the first place. So while Trumansburg's ambulance department is run by paid staff, I think it's important to note that these pressures, the network effects, and public health function are carried out by all EMS personnel, whether that's volunteer or paid. So it's essential that discussions of policy recognize the sophistication, interdependence, and immense pressure that is on the EMS network as a whole, as well as its providers, and that we reframe the policy discussion and understand EMS really as a regional healthcare network. Now, we've also pulled out some pieces of, or some recommendations specifically for the county. These are in large part a reiteration of what have come from other reports. Reducing frequent flyer calls, or understanding the liability and coming up with a policy solution to those calls. Those calls represent just a drastic percentage of the overall calls in the county. And there's something that's very difficult for individual agencies to handle. Individual agencies may not have the resources in terms of administrative staff. And it's really just outside the scope of their practice to understand the legal implications and that kind of thing of responding or not responding to those calls, and who's responsible. Is it a care facility or who it is? It would also be important, I think, to have a real-time data dashboard so that agency leaders and policymakers can see what the pressures and what the dynamics of the EMS agency look like in real time. So I know that Trumansburg, just anecdotally, we have seen a drastic spike in times where we are called to stand by at CMC. While that's something that we know, it's difficult for us to share, and it's difficult for other leaders to see and understand and respond to. So especially as the county becomes more involved, understanding that sort of high level data is really, really important. Another thing that I think is important to highlight is the ability of the county to provide EMS certification. This is one of those things that I think the county has taken on and then not taken on, and it's kind of come in waves. And we are hoping that that can be resumed. This, especially for volunteer agencies, but also for paid staff, is kind of a gap in the Tompkins County EMS network as a whole.
For the county level, for the county levels of policy, we must provide the funding to offset the increasing stress on local community resource in terms of the taxes and community labors, the volunteers and EMS staff. And secondly, the county should have the medical directors agency meeting for the EMS agencies, and the county should engagement on the regional and state EMS issues.
So there's an inherent conflict that exists surrounding EMS issues. Although many agree that it's a vital, important health service, the lack of support and structure on a state and federal level in New York completely contradict its necessity. When we call an ambulance, no matter where we live, we rely on the transport of health services to us. Assigning legitimacy to the service through reliable and substantial funding really addresses equitable health care issues in the state of New York. There are some funding model structures that we listed here already in place in New York State, like AIMS, CHIPS, or STOA, that could be altered and modified to address the support of EMS services, similar to examples that we saw in other states. Whether outright funding, reimbursement, or another form of standardized support, there are structures identified already in New York that really could model and potentially be adapted to address EMS services. There's also been momentum in recent years regarding EMS issues. There's a Senate bill currently aimed at establishing a rural EMS task force, just waiting to be signed by Governor Hochul. The bill has recently added more co-sponsors, which is a positive sign in that it's gained even more bipartisan support. All indicators in our conversations with legislative offices are that she will sign it. We did formulate some recommendations for that task force when it's formed, and those are included in our final report. A few of them are pulled out here. First, we recommended that the membership, it definitely includes representatives from rural districts, since that is the area that they will be examining. A key research point we've identified for the task force is devising a formula-based state funding assistance plan for rural areas with lower populations and call volumes. For example, identifying districts where private companies are reluctant to offer services as they have too low population and profit potential. This should be the first area to be addressed in order to ensure that health services can be provided in all regions of the state. We strongly encourage the task force to focus on solutions to the rural EMS crisis instead of painting a landscape of a pretty well documented issue. To that end, we've offered examples for them from task force reports and other rural counties that include consolidation of agencies, special state grant funding, and other sustainable funding strategies.
So one thing that we'd also like to highlight is areas that are sort of ripe for future research. Excuse me. As Rebecca mentioned, establishing a population density threshold for agency profitability is a fairly simple thing in Tompkins County, but at the state level, it's not. It becomes much more complicated for us. Bangs is profitable and the rest of the agencies aren't, just basically due to population density. Bangs can serve the city of Ithaca. But at the state level, that becomes much more complicated, and it becomes very important if the state does look seriously into providing any type of funding that can really enable the health of rural EMS services. So establishing that threshold is important. It's also important to understand what the real cost of volunteer labor is and other community resources that go towards EMS. So many of those possible funding options will rely on matching local funds that go into EMS. So it's essential that there's some way to quantify these sort of difficult to quantify costs, right? We don't want to leave volunteer agencies out of any funding that is made available elsewhere. Also, evaluating the effectiveness of the CON system, analyzing potential efficiencies of scale and sort of the broader business case for larger state or private agencies versus more local run rural agencies, an analysis of the liability concerns associated with trying to reduce frequent flyer calls. We know that you simply can't, or you can't not go to those calls. So how can we ensure that facilities with high call volumes for non-emergent causes take more of the responsibility for those calls? So by way of concluding remarks, I'd just like to say that EMS providers and agencies, they offer the level of service, coverage, and medical sophistication they do because substantial federal investments in the 60s and 70s, because New York State has developed a strong regulatory framework, because local support in the form of unpaid labor, community resources, and tax dollars, and because EMS providers are universally dedicated to the provision of life-saving medical care. Unfortunately, these factors are often at odds with each other. The sophistication of medical capabilities and the regulatory framework certainly save lives and they're important aspects of EMS, but they also mean that agencies and providers must work a tremendous amount to become proficient and maintain their certifications. Meanwhile, local support enables continued EMS coverage, but it also creates a sort of starkly inequitable and unsustainable system. So our hope is that this report will provide some of the tools necessary to overcome those paradoxes and to help create a more resilient, robust, and effective EMS network in Tompkins County and other parts of rural New York. So with that, I will end just by saying I apologize. I know we went a little bit long. I'm afraid I tend to go slower when I'm ad-libbing. But we would certainly welcome any questions, any comments. This report hasn't quite reached a final stage. So any comments, any things that you'd like to see added or taken away, we would really love sincerely any questions or comments.
Great. Thanks so much, Ben. Yeah, so I'll open up for questions. Anyway, and much appreciated. This is just fantastic. So thanks so much. So I see that Irene Weiser has a question. Go ahead, Irene.
Yeah, first of all, thanks to everyone for continuing to look at this really important issue. And I want to give a special shout out to Ben, just because Ben, I think his whole interest in getting involved in public service started when he worked on my first campaign. So I really am just excited to see where this is going, and I think that this is a really important direction. I have actually a few questions, and so of course, you know, it was disconcerting. On the one hand, good news to hear Slaterville better response time. Very disconcerting to hear that it's impacted the whole rest of the county, and that was. I'm very curious to learn. You know, what have you done to connect with Bangs to see what changes they've made? Because when we reached out to them, they were utterly unwilling to make any changes, and we had offered, you know, some money to say, hey, can you provide more service to us, and here's some money and they still weren't willing and interested. So I'm actually quite curious to learn what's changed at Bangs in terms of how they're, you know, what they're doing that's made our response times decrease and other response times increase, because and that's just, it's not a good outcome at all.
Well, I think it's worth emphasizing, first of all, and also hi, Irene. But it's worth emphasizing, I think, that we are supposing and assuming that represents a Bang specific reallocation. We don't know that for sure. That may well be an effect of just more calls in that direction, pulling resources just physically because the ambulances are going there. Or it may, you know, I don't think that Bangs is restaging or staging differently. So aside from pulling that data out of the call reports, we haven't investigated further. We haven't talked to Bangs specifically. I think, you know, there's a lot of possible explanations, and understanding how that works, I think, is important, but it's also, I mean, first I want to say that it's not surprising, right? That there would be a gap in the network, and then the rest of the network would fill in. But it's also kind of a function of the way the network works. So if that was a municipal agency, we would have a lot more room to investigate that. But I don't know, it would certainly be worth asking and reaching out to Bangs and sort of understanding at a deeper level how and why that's happening. Yeah. But again, I do want to emphasize that that's our assumption, that it's Bangs moving resources in a you know, in a specific way.
Yeah, and so sort of related to that, one of the works that somebody did, it wasn't in the CEPA program, it was in the systems engineering, was to do a mapping of response times based on the data that you guys used, and then look at how response times could be more levelized across the county if Bangs were to relocate ambulances to be stationed in different areas. So even just having an ambulance stationed in East Hill Plaza as opposed to downtown was going to, you know, reduce certainly response times in Caroline, but also in a lot of the other areas surrounding the part, you know, areas that Dryden had a hard time getting to too. So you know, and even the town of Ithaca. So anyhow, it might be worth looking at that map, and I don't know if it's worth you know, the county having a conversation with Bangs as to how they might relocate and readjust to even out the service. So anyhow, so it was, you know, startling, disturbing, and, you know, hooray for Caroline, but bad news for everybody else. I wondered, I had put together a proposal that SEPA never picked up of a way to start to address the frequent flyer concerns. And so, you know, I hope that maybe that proposal can be reconsidered and carried through by some students in coming semesters. And Yeah, oh, and just when you refer to EMS, when you're talking about EMS service from Trumansburg, I just want to kind of point out, but also question, there's different levels of training and service that's able to be provided. So EMS out here in Caroline is provided by volunteers who typically have, very low levels of training versus EMS in Trumansburg, where you have, presumably people who are paramedics. And so I just, as you begin to, further develop the model of what you're wanting the state to look at and, to serve municipalities, I think there's also, the issue of the level of training expectations, and having people who are adequately trained, with a short response time maybe not transfer capabilities, right? So if you have first responders who are trained at a certain level, who can at least get out and provide the basic stuff until ambulance transport gets there, that's a big deal if you can reduce that response time of qualified. So I just want to suggest that be another component that you look at going forward is the level of training, and of course, we had research on this too and data on this, but the pay scale and and the problems for keeping paramedics employed, because the pay scale just isn't competitive with other work and training that they could do to get paid much more handsomely. So yeah, so I guess thank you for this and for keeping it moving.
Thank you, Irene. Those are good comments. The one thing I do want to point out just real quickly is that you said good news for Caroline and bad news for everyone else. And I don't necessarily think that's the case. I think we should all see this as evidence that the system, at least to some degree, does work, right? That the dynamic, the mutual aid, all of those systems do work. So it is a dynamic system that will sort of move to fill in gaps. I think in this case, that was enabled really because we have a strong service in Bangs, and then we have strong municipal support sort of surrounding it. So it enabled that network to really be dynamic and to, I think, operate effectively. So I wouldn't characterize it as bad news for everyone else. I think it's if anything, it's a vote of confidence for the ability of the network to adapt.
And actually, Ben, thank you for that. It raised a question for me. When you have response time, what level of response are you looking at? Is that the response time of ambulance, or is it response time of, anybody who's got any training at all, or what response time are you measuring?
So that's response time. I can actually pull it up if you'd like to for the different call determinants. So it spans the whole.
But so is it the time? Is it the time that it took for somebody with some level of EMS training to arrive on scene? So it's
Yes.
not necessarily the time it took for an ambulance to arrive on scene.
It would be, yeah, not necessarily. So it would be a medical provider. I mean, that person may be BLS, ALS, but it's not necessarily an ambulance. No, it could well be
Okay.
a rescue.
Okay, so it could be that we've got more volunteers who are stepping up that are reducing our response time, and that
Yes.
Newfield has fewer volunteers who are able to respond. Okay, so this
Yep.
is not emblematic of ambulance. It's emblematic of or related to whoever got on the scene first. Okay.
Well, anyone who was toned and got to the scene. Yeah, so it wouldn't be just
Yeah.
someone showing up, but yes,
Right,
a
yeah,
rescue
yeah,
or
yeah.
ambulance. Yeah.
Okay.
Great, thank you. Ann Corman has a question. Go ahead, Ann. Let's see. I'm trying to unmute you, Ann.
Okay, thank you.
Great.
So thanks for the report. So one question is, I want to start with, you mentioned Trumansburg having to be on standby or asked to be on standby at CMC. I just wasn't sure what that was about.
I suspect actually that Rorden or Jamie or Justin could cover that question better than I could really, but essentially if Bangs's ambulances are out, if there's a lack of resource in the city of Ithaca, then sometimes Trumansburg will be called to stand by at CMC, basically to backfill coverage. A similar thing happens with fire departments. You know, if one fire company has to go out to respond to a big call, then we will frequently you know, bring our apparatus and some of our volunteers to stand by at their station just to backfill the coverage so that an area isn't left without responders.
And so physically you have to go send an ambulance down to the hospital?
Yeah.
Okay.
Yeah, that's right.
And then
Yeah, and this is Rorden. We can have a more in-depth conversation about this anytime. Essentially, over the last 18 months or so, I've seen a significant increase, and I would say it's as often, and Justin can pull the statistics, as often as probably twice to 3 times a week, where Trumansburg EMS is essentially backing up Bangs in the city of Ithaca or nearby, based on Bangs being stretched very thin. And just over the last, I would say, 6 to 9 months, I've begun to see a number of calls that we have taken within the city of Ithaca on what are clearly law enforcement related calls. So that is some function, and obviously I don't have a way to directly quantify this, but it is some function of short staffing on the law enforcement side of things that is then having county dispatch provide medical assistance to whatever that call might be, which is then increasing Bangs' volume, which is then requiring them to request assistance. So that is definitely increased and something we can look at more closely if you'd like.
Okay, yeah, I'd like to do that. And then another question on the frequent flyers. So that would be interesting to look at that if there's some data like across the county, like, you know, so for, you know, we don't have to go into that now either, but just, you know, for instance, is it elderly folks that the county office for the aging could, you know, connect with to see what services, you know, that they could need or assistance? And then wondering about the county training that was provided before for EMS certification. So was that, wondering how long ago that was last done, and were we paying for it, coordinating it?
So that's actually, oh yeah, thank you.
Yeah, I can speak a little bit on this because the class that was offered for Tompkins County was a CFR, which is like it's a step above like first aid CPR, but a step below basic EMT. And this was offered back in 2019 before I took my position here as the county coordinator. And it was put out to all the different agencies within Tompkins County and surrounding areas. And the level of response at the time was great. We all wanted this class, but when it came time for the class to start, only 2 people showed up. Which caused the class to have to be canceled because unfortunately you're looking at classes like CFR, EMT that have a class minimum that they need to run the course, and if it doesn't reach that class minimum, then unfortunately the class has to be canceled. And that's pretty much standard around the state with fire and EMS training as well. So and then it creates a difficulty to try and get one of those courses again because, you know, the interest was there, but when it came time to put people in the seats, it didn't show up. So it makes it harder to get the classes again, because if you can't fill it once, they look at that and they're unfortunately they move the classes to areas that can put the people in the seats. So it is something that's a hard process to get a class and to continue classes. But it is something that I myself am taking on and trying to drum up the business to try and get the people in the seats, because I want Tompkins County to be able to be a more prevalent in training for EMS.
Because if they can't do it here, then they'd have to go where, to Syracuse or Binghamton?
Yeah, other counties offer it. Cortland County, Schuyler County offered or tried to offer a class as well, and I believe that one also got canceled. And then New York State Fire Academy, they do an EMT class. Usually, I think it's twice a year. The only issues with that is it's not very conducive to especially volunteers, because it's weeks long. It's like 3 weeks long during the day. So most people would have to take off from work and use vacation time and everything to take these classes. And it's not very conducive, like I said, to volunteer agencies.
Wow, yeah, that's incredible, especially for people that have families and have other jobs to support themselves.
Yeah.
So last comment is just I know I think it was Ben who said that this is not quite finished, the report, but either soon or when you feel it's finished, or as finished as it can be for now. I'd like you to consider doing this report or presentation for the county legislature, because I think it's definitely an area of interest, and it's an area that we could see how we could help. And so you could, I think, starting in January, the new chair of the legislature is probably going to be Shauna Black. So you could reach out to her or one of the clerks of the legislature to do that.
Thank you, Ann. Yeah, we would love to. I think broader county support is really, really essential. We'll definitely take you up on that.
Great. Any other questions? We have a few more minutes.
Well, I'll just add that SEPA is capable of looking into other research questions as they come up. I think this idea of a threshold for population density is an interesting concept with regards to what do we need to make an ambulance agency profitable and function, and that's a question that another study could look into. But we really like these studies to be geared towards action. That's one of my priorities when I take on something, like what will come out of this. And the fact that Anne, you've expressed interest in having this group present to the legislature means a lot to all of us. I say that wearing both my hats as a town official and as a Cornell person involved in this report. So I think the group would be happy to do that, or some members that are available. And it could be an abbreviated version if necessary. And also, the action that we're doing with the state, I think is key in this report, and that the state is interested, at least certain members of the state Senate are interested in pursuing this issue. And I just want to make sure everyone's aware that this legislation that's pending could really bring a brighter light to this entire issue when the governor signs it, and establish a commission to look at this issue, and particularly look at new funding models, which I don't think they were thinking of prior. It was this group that was speaking with the legislative staff, and they brought up the idea of using the AIM model or something else, and it got their attention at the legislative staff level, which is exciting, as well as adjusting the Medicaid reimbursement levels, which I think the state could do. that would be a big boost, and that we haven't talked a lot about, but we know at the ambulance, budget level, that matters a lot, getting these Medicaid covered calls fully paid for by Medicaid. So the ambulances aren't taking it on the chin, or they're in the municipalities who fund the ambulances. So these are things that could happen at the state level that are exciting, and so that's where this work is headed. But I think it's something that this EMS subcommittee can look forward to requesting another report if we can really specify what we want and how it will be actionable.
Great, thank you, Dan. Any comments or questions for Dan before we adjourn? So, well, I really, really want to express my gratitude to you, Dan, and Riordan, and all the Cornell students for this work. I know for me that this has been really informative. So, and it's exciting, and I really appreciate your commitment to looking for actionable items. So I look forward to pushing forward on that, and I thank you so much. So.
It's been our pleasure.
Thank you all. You're very welcome.
Yeah. Great. Okay. With that, I'll adjourn the meeting. Thanks so much, and everybody have a great weekend. So.
Thank you.
Thanks, everybody.
Bye-bye.